What if you could take action to reduce crime, improve health and education levels, increase family incomes, national and local government revenues, and improve the quality of life in communities throughout your area? Where would you begin? Science tells us that we may find the solutions to these complex social problems in early childhood, when the architecture of the brain begins to form. Brain architecture is built over time and shaped by experiences, starting in the earliest years of life. The most important experiences come from the environment of relationships that interact with each child: parents, extended family, and caregivers of all kinds. But serious adversity early in life can disrupt healthy brain development. Both brain architecture and behavior are increasingly difficult to change as individuals get older, so what happens early matters for a lifetime. Now imagine you can take action to improve the lives of babies, children and young people, as well as the quality of life in this community. Where and when would that action be most effective? The links between policy, parenting and brain architecture become much more clear when we can see how formative events and family and community environments affect child development. For example, policymakers want to make their community safer and healthier, or improve children's learning, or reduce the cost of social problems. A child raised in this environment may experience lower levels of stress and more opportunities for learning. That leads to sturdy brain architecture and a healthy stress response system, which enables the child to build an early foundation for social and emotional skills that lead to improved school achievement and readiness for work, life, and raising great families of their own. Positive early experiences can also reduce levels of obesity, diabetes, and heart disease. Improved physical and mental health and higher attainment levels can have positive effects across society, like reduced crime, and increased income and tax revenues. Policies affect both individuals and communities, so making wise choices that support early brain development can improve health, behavior, and learning throughout life to give everyone the bedrock to realize their full potential. The Early Intervention Foundation will assess, advocate, and advise on the best early intervention policies and practices. Please visit our website for more information. Hiya, this is Graham Allen, almost live from the House of Commons. I just wanted to welcome you to the Safeguarding Conference today. What an important thing that is, and delighted that you're all here. I'm going to say a few words about the Early Intervention Foundation. I'm very proud of it, and it started in Nottingham. You helped start it, and everyone in the UK now looks to you and looks to us to take this further. So today's conference is going to help do that. Just a month or so ago, we had our 5-year refresh for the Early Intervention Foundation, and that's the first 5 years done, the second 5 years about to start, of a 20-year Early Intervention Foundation, Early Intervention City. I'll tell you about the foundation in a minute. And I think that shows how serious we are about tackling the problems long term and tackling them intergenerationally. You know, there are lots of people who say, if only we can get the quick wins and the low-hanging fruit and all the rest of it, you know, if we could have done that, we would have done that a long time ago. So what we did in Nottingham 5 or 6 years ago is set our stall out to tackle the things that really matter, the things that really make a difference, and they can be long term. But the essence of what we're trying to do in Nottingham, and what I'm trying to do nationally now, on the back of the example created by Nottingham, is really to help babies, children and young people have the social and emotional capability that they need to make the best of themselves. If you have that social and emotional capability, then yeah, there are no guarantees in life, but things are going to go okay. You're going to have those basics in place. I can tell you, if you don't have social and emotional capability, you're always going to struggle, and you're always going to need more and more public services. So early intervention really is about that social and emotional capability, and what we need to do now is to make sure that we take that to scale, that we take it to scale across the UK, and that's one of the things that the Early Intervention Foundation nationally is going to do. Two really important reasons to do that. Firstly, because of the babies, children and young people and their families themselves, obviously. We want them to grow, we want them to be rounded human beings, we want them to enjoy the empathetic behaviour and the attachment and attunement that you've enjoyed and you've handed on to your children. And also, it's going to save us an absolute fortune. We talk about living in a time of austerity, so how can we afford billions and billions of pounds thrown at the costs of failure when it's so easy to intervene early, so easy to actually cut off the supply of those things. If you give people social and emotional behaviour, you can reduce the bills on low attainment at school, remedial teaching, all those things that we're talking about today in respect of safeguarding, drink and drug abuse, the lack of aspiration at school, holding down an effective job. All these things, if you don't get those right, will cost us all a lot of money, and we can't afford that money, nor can we afford to pursue policies that waste that valuable money. So that really takes me to what the Early Intervention Foundation is doing, using the example that Nottingham has pioneered so well. So the Early Intervention Foundation is going to do three things, and they're things that I hope will be helpful for you. Firstly, we're going to assess. I remember these things being a rather slow-witted Member of Parliament by 3 A's. So the first A is assess. And that basically means getting the right evidence, finding out what works. And if we can figure out what works, then we can actually make sure that those are the policies that we roll out, rather than ones that seem to be good, or people like them, or they bring a smile to a child's face. That's not the test. Do programs really work? So we're doing a rigorous analysis of the programs that are out there, so that we can make available to you on our website and also down a phone line to actually say which are the best policies out there. The second A is advise, and we've got a team of advisors who are working with now 20 places in the UK. One of those places obviously is Nottingham, but there are many, many others too. And we're learning from those places initially and trying to spread the best practice, actually work out what works for everybody else. We'll even give people 20 days direct advice. Nottingham aren't going to get that, by the way. We're pretty well equipped at the moment, so we won't need that. But there will be places that could do with that, and will get that service from us. And the final A is advocacy. And that is for people like me especially, to get into the Treasury, to get in front of government ministers, to get in front of opposition politicians, both national and locally, and actually explain why our culture of late intervention, forever picking up the pieces, expensively, and only ever partially successful, is not the way that we're going to build this country in the future. We have to build that on a much sounder footing, and that is early intervention, being preemptive, cutting off the supply. And that's what we did in Nottingham with about 14 different policies around that cycle, 0 to 2. We had Family Nurse Partnership, which came to the city, the SEAL programme in every primary school, and Life Skills, which should be in every secondary school, to build up that social and emotional capability. So, good luck today. I think I wish I was with you, and I'll definitely be with you next time. But you're in very good hands. We've got a tag team forming, people like Katie Ball and Lynn McNiven, Viv McCrossan, Phyllis Brackenbury. They're going to take this on because I can't be there this morning. But I'll be there on another occasion, and you're in very good hands. You'll be working with and listening to the real pioneers, the people that did the great work. Sometimes I get the credit for it, but the people who did the hard work are the people you're now going to hear from. Enjoy the rest of the day.